Hi all. I'm presenting on the topic of DSS diabetes mellitus as part of my course for Health Info 730. DSS stands for Decision Support System. So what does a decision support system mean? A decision support system is an electronic system designed to aid directly and in clinical decision making in which characteristics of individual patients are used to generate patient-specific assessment or recommendation that are then presented for clinicians for presentation. But DSS also comes with other responsibilities. To err is human, DSS helps in improving patients' safety, quality of care, and also have become a key requirement in the electronic health records for the EHR. Basically, there are 5 rights for a DSS to operate: a right to information, to the right person, in right intervention format, through right channel, at the right time. The topic that I have taken for the DSS is diabetes. Diabetes is one of the most common disease that is prevalent across New Zealand, across the world. Mellitus in Latin means sweet as honey. It is a condition that occurs when the level of sugar is too high. Over 2.4 million New Zealanders have been diagnosed with diabetes mellitus. So at least the population of New Zealand is around 5 million. So imagine half of the population is having some sort of diabetes. And initially this was prevalent among adults. Now it's increasing among children and teenagers. And around a million people may have diabetes, but they have not yet diagnosed. And this can lead to coronary heart disease, kidney damage, stroke, circulated problem, eye damage. It is reaching an epidemic proportions among Maori and Pacific Islanders, New Zealanders. So this is one of a major problem where people not addressing at the early stages, or it is not getting detected, or they're not doing adequate testing. It is once it becomes too serious, once people find out the symptoms or it becomes more serious, they kind of tend to go for any of the treatments for diabetes. The health risk of diabetes is heart and blood vessel disease. It can damage to nerves. It can cause neuropathy, kidney diseases, visual problems, foot problems, hearing impairment and impotence, and also skin infection. So it just affects not one part of body, it just affects everything of the whole body. What are the factors that cause diabetes? One is weight, inactivity. People don't move around, they're just sitting at one place. The current generation, most of the people are using desk jobs where they sit for long hours without any physical activity. There might be family history that can increase the from the parents to the children, and the age. As people get older, kind of we tend to exercise less, lose muscle mass, and gain more weight. And also big problem is it's also increasing quite among children. There's gestational diabetes, high blood pressure, and abnormal cholesterol and triglyceric acid. So there can be various factors, not one. So it is quite hard to uh, exactly pinpoint this is the root cause of diabetes. It can just occur, it can come through any format. You might feel always healthy, but suddenly some one of the anomalies can create this diabetes. So one way how diabetes 2 is managed is hyperglycemia management system. So this has been developed to kind of take care of people who are having diabetes. The first thing that people can start with, if they have the basic starting of my diabetes, kind of start with the lifestyle management that involves dietary monitoring, high fiber, low saturated fats, and proper ratio of carbs. And also, individual person has to do physical activity monitoring, go for walks and exercise. If if it if this lifestyle management is improved from whatever is the slow lifestyle, diabetes can have can be brought in control. If not, the second stage involves monotherapy. It involves lifestyle management plus metmorphin. Metmorphin is kind of a dosage that involves and administration. So once it is targeted for 3 months, and then if people need to be continuously monitored, and if there's some improvements, then it's good. Well, they stay in this monotherapy, or if they have done profound, got it under control, they can go back just using a lifestyle management. They can control it. If it goes exceeding to the next stage, they have to go for a dual therapy, where they have whatever they're doing for monotherapy, and but then there's an additional second agent involved that include sulfonyluresis, and that needs to be kind of administered, or there is another SGLT2 inhibitors and insulin. So with dual therapy, if there is improvements, again, that needs to be monitored for 3 months. If there's improvements, well and good, they can stay on this. If there's rapid improvements, they can go back to monotherapy. If not, things go worse, then they have to go on a combination injection therapy. That includes like all this lifestyle monotherapy and dual therapy, and then there's also basal insulin, and there's pre-assessment therapy. Injections are administered, and so this whole process is such a big process, and people are stuck for 30 or 40 years of their life just going through monotherapy lifestyle. It is like a jail that you go in and you can't come out of it, you can't break through. And diabetes involves with food, and it is quite pretty hard to control. So a big problem is getting the accurate data is quite hard. So one way of doing is like automated data collection, where a patient can have different tools or devices like a glucometer or sensors, or whatever activity they are doing, some apps and insulin pump, and this goes into an algorithm and sends the data to a decision support system, or to a server, or a metadata location, or a data store. And then from the internet or cloud-based solution, a physical physician can actually see the data and supervise the data, and either monitor it and go for it. So we've devised in a decision support system for diabetes mellitus. The causes are high sugar intake, genetic, lifestyle, obesity, and the symptoms are here, like which is increased urine output, slow healing of wounds, fatigue, and loss of appetite, excessive thirst, hunger, skin problem, tingling. So once people never kind of uh, realize that they have diabetes until one of these symptoms come, and then is the stage when people go for a diagnostic workshop. Then they recommended a oral glucose test, a renal function test, fasting, and urinary analysis. And this data can be fed into another data management system. So in this, we want to introduce kind of a real-time physical activity monitoring that kind of has a mobile app, activity watch, and heartbeat and pulse. So along with that, a dietary monitoring system where people can just put what carbs they have had, or some kind of an app that says that this is a high fiber, high cholesterol food, or less cholesterol food, so they can make a decision. And along with this, it can be combined to a EHR, which has the patient records and existing medical conditions and and also a real-time glucose monitoring that keeps on feeding to the system. And with the help of MI and data system like real-time processing, information from device, different data stores, data mart, and big data system and cloud-based technology, all these information can be fed back can be accessed by a clinical assessment, or a doctor, a physician, or a nurse, and they can recommend the required prescription, or recommend the patient to move to what kind of program, like a lifestyle management they should go for, monotherapy or a dual therapy, or a combination of it, and stop the medicines in case if they have profound improvement in their lifestyle, or their diabetes is under control. They can go for a lifestyle management alone. And there can also be a more of a physical assessment here in this place, a monitor weight. And also one more thing is that there can be a real-time alerts based on the decision support system, recommend action automatically, dispatch an ambulance if there is no heartbeat, or if the person has fainted, or it also can check what new medicines are there, and create alerts. So there is a quite in DSS for to manage diabetes. there needs a lot of information that is required for going for person into different lifestyle management or into monotherapy or dual therapy. But this data management information system can be a boon to both the patient and also to the doctors, where they can quickly access real-time information. Most of the time, people have to wait for the diagnostic workshop results, which might take 1 or 2 days, or getting all the data is quite hard, and putting it all together into one format, and also using a DSS system, using machine learning and algorithms, it can predict that what state is the patient and help the clinicians to have the right proper prescription or right, and this can also help in better management of the medicines or administration of the medicines. What is the benefits of this entire system will help enable the uh, accurate clinical assessment, helps in to better integrate with technology for faster result. Use of machine learning and artificial intelligence will help in faster detection and recommendation of problems. And this data can be gathered from different devices by doing physical activities. This can also help to correct the medicinal dosage. Sometimes patients are given very, very high dosages that might not be required. There might be a allergy or some reaction to certain kind of food or some other thing. So with the help of data, the physicians are in a better position to give the right kind of dosage, and better integration of data and data points will help in research and corrective measure. And with all these data points, this data can be further used in developing precision medicines, which can be targeted to that particular individual, not combined like mostly people are on generic medicines, but this can help people to have the right dosage, to have the right amount of insulin, and accurate alerts and reminders can be sent using modern gadgets. The DSS can help with that, and this can help the change life of both the medicine professionals and also the patients. And ultimately, by having putting a right DSS system, can money and avoid unnecessary medication. That's it. If you guys have any questions, feel free to mail me and call me. Thank you. Have a good day.